Hey folks, it's Patriot Nurse. I ended up having to do 3 segments here because I got caught off. Okay, so when we left, we were talking about the honey burn care method. Okay, how to care for a 2nd degree burn with the honey method. Okay, so let's backtrack for a second. All right, so after the initial cooling phase, you've cooled the burned area. In the honey method, what you're going to do is, after that area is cooled, you immediately pour honey into it in this method, okay? And then you cover it real good, not stingy with the honey, but you really slack it on in there, cover all surfaces, cover it really good, and then cover it with a plastic sheet like saran wrap, for instance, and that you leave it there. But after the first couple days, you don't clean it out, you just pour more honey into it, replace it and pour more honey into it, and you do this for about 15 days. Now, at first thought, for those of you who are not so keen on this, it may be, are you kidding me? You're pouring something that has a sugary base into a wound. Here we go. The rationale behind the honey burn care method is the following. And I'll draw upon your lived experiences here if you have young children for this to understand. Why do we not give honey to children under the age of 1? If you look, it says do not give honey to infants and children under the age of 12 months or something like that. The reason for that is because honey is so effective at blocking out oxygen that it is a perfect breeding ground for bacteria that cannot live in the presence of oxygen. They're called anaerobic bacteria. Okay? And that's why you can't feed it to infants under a year old, because their immune system is not to the point where they can tolerate that. Okay? Now, your thought is, holy crap, if I pour that into my wound, then I'm going to have anaerobic bacteria in there. But what do you have on the other side of that honey? You have tissue that's getting what? Blood flow. And what does blood have in? Oxygen. You guessed it. So, with the honey method, the thought process here is that neither anaerobic nor aerobic bacteria can grow there, because on one side of the wound, on the body side of the wound, you have tissue and blood flow that's getting oxygen, but on the outside of the wound, which typically you would be getting oxygen from, it's sealed out. The honey has sealed it and you're not getting any oxygen. And there's a doctor in India that has been using this and is having fantastic success with it as compared to our traditional methods of, wrapping the wound with gauze, etc. So it's a great theory, and I think the Egyptians actually used to use this. It's been documented. There's like hieroglyphs or whatever of them showing them using honey or whatever. So that's just a thought to think about if you've got access to honey. Now, you may not have access to honey, okay, but you may have access to potatoes. Okay. Now, in the study, there was a study that was done that compared the honey 2nd degree burn care method versus potato peels. And potato peels did not perform as well as the honey. I think the honey performed 50% better than the potato peels. However, the potato peels performed better than the traditional methods. So, just a thought there, just to use your discretion and to plan ahead and make your own decisions there. With the potato peels, what you do in the boiled potato peel method is that you take the potato skins, okay, that you normally would take off if you were making mashed potatoes or something. You take the potato peels in long strips, or even wider ones if you can manage it to kind of make a more intact peel. You boil it to kill off bacteria, and then you apply the wet side of it to the wound. And from the potato peel method, it works like, it's what's called a hydrocolloid dressing. The potato peel is similar to what we call hydrocolloid dressings that are used. They're synthetic type of things, or they use like an algae base in the hospital. So the potato peel method isn't as good as the honey method from the evidence that I have seen and the research that I have looked at and reviewed, but it is better than the traditional methods of the gauze and the non-adherent pad. So that's just something to think about there. And I hope that this has been informative for you, and I hope that it has served you in some way. So that's just my little 2 cents again for today. And this is Patriot Nurse signing off, and I'll see y'all later. Bye.